Folks, thanks for coming on the line with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so, probably closer to 45, learning about some of the options you have here in the great sovereign state of Texas with Mutual of Omaha and the Medicare and ancillary portfolio that they offer folks that market in this great state. A little bit of housekeeping. Today's presentation is being recorded. It, along with additional resources, will be sent to all who have RSVP'd to today's presentation, and that hopefully will follow by the end of the day. It all depends on how long it takes the recording to update for us. We appreciate you coming on the line with us today, and without further ado, let's give you a little bit of information about Premier itself. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country. We act as an insurance wholesaler offering insurance services through independent insurance agents such as you. And we offer those contracts at the highest possible commission levels with recruiting contracts available to those who qualify. We mentioned we were founded in 1968, so this past year was our 50th anniversary. It's a great milestone to be reached by a small family agency in rural Nebraska that's become one of the largest players in the marketing arena in the Medicare space for both Medicare Advantage and Medicare Supplement programs. That portfolio that we offer is a robust one. It's a full gambit of Medicare programs, including Medicare Advantage and Medicare Supplement programs, standalone Part D programs, a life insurance and annuities portfolio that includes final expense and pre-need programs, long and short-term care plans, disability income programs, and the ancillary benefits that are so important for all of us, the dental, vision, and hearing programs, the critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio is a large and robust one with all the big players in the market and many of the strong regional carriers. Major carriers include today's guest with Mutual of Omaha. That full portfolio of products, that philosophy carries over into the prescription drug arena, where once again, our featured host today, Mutual of Omaha, has a strong offering for us. That Medicare Supplement portfolio is very vast. We offer different tools that make marketing these programs very easy for you. And once again, featured program, Mutual of Omaha today. That the ancillary product portfolio that I mentioned gives us the opportunity to help the folks that we visit with year in and year out, establishing additional revenue streams and taking care of the additional needs that our prospects and clients have that aren't covered by some of the base medical programs that are available to the Medicare population. That includes a gambit of dental, vision, and hearing programs and programs that help folks that are stricken with certain critical illnesses and those folks who go into the hospital and suffer the expense of that particular medical stay. When we look at the Medicare market overall, you don't come on a presentation like this without a marketer or a carrier saying, well, gee, there's over 10,000 people a day turning 65 and going on to Medicare. And that's true. The baby boomers are aging into the Medicare market. And you can see by this graph, it's a near exponential growth, but that's not the entire Medicare market. We got to keep in mind that about a sixth of the Medicare recipients are under the age of 65 and are entitled to that coverage because of disability. That population is very varied, so it behooves us to have a strong portfolio of products that cover folks across the gambit with the different health conditions that they face and the income constraints that many of them have. It helps for us to make certain that we're able to offer the programs that take care of the people who support us in our way of life. It's also important to note that there are certain ways and means that we have to follow in order to enroll people into different Medicare programs. And so we want to make certain that we stay on the up and up and compliant and do things as the government dictates in this particular situation. So we have a number of different enrollment programs that go on through the year. We just finished with the OEP program, And that means we're now in a lock-in or special election period. And we can see by this particular slide that there's a lot of opportunity to help people on a year-round basis. If we go back and look at those characteristics that we had of the Medicare population, a lot of the folks are fighting particular chronic illnesses or have income constraints or move or whatever the reason is. There's the majority of folks that are on Medicare that have an opportunity to change their coverage even though they are technically in a lock-in period. One of the things that affects us coming up as well in 2020 is legislation that prohibits newly eligible beneficiaries from obtaining a Medicare supplement plan that covers the Part B deductible. The MACRA legislation doesn't do away with those programs that are fully covering the Part B deductible, but it will not be available to those folks that are coming into the program, the newly eligible folks. And that takes place the first of next year in 2020. This gives you an indication of how those plans look, the standardized, modernized Medigap programs with 2019 numbers. And we can see as we go through different comparisons, how the benefits stack up, and some of the tools we have help you realize what the cost differences are between those programs as well. And that's available to you through our complimentary quote engine for agents that contract with us. What we are doing here today, though, is giving you additional information about Mutual of Omaha and the opportunities that you have here in Texas. And we have a guest speaker with us here today. Ms. Christy Myers is the Sales Director for Medicare Supplement, Dental, and PDP programs for Mutual of Omaha, based out of Omaha, Nebraska, obviously. And she's been with Mutual of Omaha for a long time. In her free time, she enjoys camping, cooking, and spending time with her husband. And this is a good place for us to say, John, be still, turn over the helm to Christy, and let her tell us about Mutual of Omaha's offering in the state of Texas. So Christy, we're switching over control to you now, and you have the helm.
Wonderful. Thanks, John, and welcome everybody on the call here today. As John mentioned, today we're going to go over a little bit about our portfolio specific to the state of Texas and 4 great product offerings that we have available to each of you from a Medicare Solutions type standpoint. So let's go ahead and jump in. I want to start with our flagship product here at Mutual of Omaha, which is going to be our Medicare Supplement portfolio. Want to highlight a few things here for you. First and foremost, we are definitely going to be that experienced carrier that you are looking for out in the market space. In fact, this is going into our 53rd year of continuously selling Medicare Supplement products across the entire country. We have been selling Medicare Supplement now since Medicare began, all the way back in 1966. We currently do rank as the 2nd largest Medicare Supplement carrier in the country. We continually have high ratings with the rating industry. Right now, we have an A+ superior ranking with AM Best. Last year, ending in 2018, was no different than any other year prior to, in which we had another record-setting year with over $2.8 billion in earned premium on our Medicare Supplement portfolio. And right now, we insure over 1.4 million policyholders with a Medicare Supplement product. With all that experience that we do offer you also comes some technology that's going to make it a lot easier for you to do business with us. First and foremost is going to be our Medicare Supplement e-application. That is a tool that we have had out in the market now since 2011. And each and every year, the use and number of agents that use that tool each and every day increases. Right now, over 70% of the new business applications that we get in the door for MedSup do come in via the e-app, and there's great reason why. First and foremost, usually they do issue in the same day in which they're submitted. Even on a fully underwritten app, meaning that you're taking all those health questions and collecting prescription drug information, During normal business hours, those applications are reviewed typically within 20 minutes by an underwriter. So time service is definitely key and really can't get much faster than doing an e-app. The e-app also offers you multiple signature options, which include both voice and electronic. From a customer standpoint, when you do an e-app, they would have an option to receive a temporary ID card as well as electronic EOBs. A few additional benefits for you and your clients. When you're doing quotes, I do want to point out, be sure to check and see what is the policy fee that that carrier might be charging. With Mutual of Omaha and any of our affiliates, we do not charge a policy fee when taking out an application for MedSup. One great thing that we have now transitioned to for our entire block is this second bullet here on screen. That is, as of right now, we currently rate our entire block on an anniversary rating basis, meaning your customers that take a Medicare Supplement policy with us will only receive one rate adjustment per year, and that rate adjustment will always occur on their policy anniversary date. If you've been selling with us for a number of years, prior to that, it would have been on a renewal basis, meaning a customer could have actually had 2 increases with us in a given calendar year, one of which would have been their age step, and then potentially a few months later, when the state in which they reside was taking their medical claim trend, they could have received a second adjustment. As of right now, all states and the existing block of customers that we have all transitioned over to that anniversary rating. So one rate adjustment per year is good news for both you and your customer. Mutual of Omaha also offers a 12-month rate guarantee, and that's going to be from policy effective date. From policy effective date is key because we do actually allow for you to take an application 6 months prior to somebody's Medicare Part B enrollment date. So in that example, they would actually be locking in a premium rate for almost 18 months. For a long time now, we've definitely had some rate stability within the market space. Since 2012, our rates have been very, very stable. In most instances, they have been single digit across the entire country, across all plans. Another thing to keep in mind as you're doing quotes, our rates are based at the age at your current birthday at the time of application signature. So by that, what I mean is, let's say you have a customer who is looking to you to move their MedSup plan for a 5/1/2019 effective date. They're currently 67 years old, but they have a birthday next week. You're meeting with them today. With Mutual of Omaha, you would actually charge them the rate at time of app. So if you're doing that app today and they're 67 years old today, the premium rate that they would be charged would be that of a 67-year-old, even though their birthday is next week and their policy effective date has not yet started. That does differentiate us from the competition. And then last but not least, another added benefit for you and your clients is we've added in now the flexibility for renewal premium options to have the ability to pay any day, making it the most convenient date for that consumer to pay their ongoing premiums. So they can pick things like, I want it to always be on the first Friday of the month. I always want it to be on the 14th of the month. Maybe they want it to occur on the last day of the month. We now have the flexibility to make that happen for them, which is really good news. Regarding the plans that we sell, I do want to make note here first of, we do have very competitive rates regarding Plan G and high deductible F. Plan G has been our most popular plan now going back many, many years. In fact, last year, over 80% of the new business sales that we had come in the door were sold as Plan G. But I do want to make note, Plan N is definitely taking a strong leap forward. And in some market areas, we're actually selling more Plan N than we do Plan F. And I think as we move to the future and the macro plans come into play, starting for the newly eligibles in 2020, I think we'll see Plan N becoming even more popular. In the state of Texas, our household discount is going to be 12%. That 12% discount is very easy for individuals to qualify for, and they can qualify in one of two ways. One is, are they married to anyone and do they live together? So they do not have to be of any specific age. If you are taking my app today and I'm a 67-year-old female and I have a husband who is 57, the fact that we live together and we're married, I would qualify for that household discount. The other way I can qualify for the 12% is if I live with somebody who is an adult and we live together. As long as we're living together, I would qualify for that 12% household discount. So by that definition of qualification, it's about 85 to 88% of people would qualify for our 12% household discount. And then in addition to these popular plans and our household discount, after purchasing a policy with us, consumers learn of a couple of value adds that we have included with their policy. They come at no additional cost to them. One is going to be a vision discount program offered through IMED, and the other is a discount on hearing aid testing and batteries with Amplifon. Some incentives and information regarding you and how you can benefit from selling our products. Number one is going to be if you're on a contract and which includes advancing, please note we do not charge interest on advancing. That is different from what a lot of carriers do out in the market space. We also have a world-class agent incentive trip known as Mutual Sales Leaders. And then right now we have 2 marketing programs going on that I'll touch base on here in just a moment. But regarding our agent incentive trip, right now you are earning credits to join us in London, England in March of 2020. It's going to be a great trip. I have heard a lot of positive buzz from agents regarding definitely wanting to be able to join us in on this trip. And to qualify for the trip, you are going to need 275,000 production credits. And then production credits are based on annualized new business premium. And you earn credits for selling both Medicare Supplement and our dental and vision product. And you earn 1 credit per each dollar of that annualized new business premium. You can always check your status at mutualsalesleaders.com, or you can call into our sales support team and they can let you know where you currently rank regarding qualification for that trip. Regarding some of the marketing programs that we have going on, the first one I wanted to touch base on was our MedSup Marketing Credits program. This program has been running for a number of years now, and it is unique to the industry. But this program was designed to help you continuously grow your business, specifically with Mutual of Omaha. And the way in which you qualify is every month in which you have at least 5 or more MedSup issued apps, you earn credits. And credits are going to be the same as cash. And the way the credits add up is you earn 1% of the annualized new business premium if you do an e-app, and you earn 0.5 percentage point of the annualized new business premium on a paper app. Those credits you then redeem in for cash back. Typically, the number one thing people are getting redeemed for is going to be leads. We have agents that turn in for postage on mailings that they've done for MedSup or for dental, maybe some tech items. Maybe you're so busy and you've been selling so much, you had to hire an assistant and they needed a computer. We would reimburse for that computer. Really, the sky's the limit to what these credits can be redeemed for, but definitely leads are going to be the number one reimbursement item. Right now, you've been earning credits since October 1st of 2018. You will continue to earn credits this year through September 30th, and then by November 30th of this year, you will need to redeem any credits that you have earned. You can always check to see how many credits you have available on our agent portal, which is Sales Professional Access. So how many credits can you earn? Actually, there's no limit to the number of credits that you can earn. But here's a quick example. If you are one of those agents that want to join us in London, England next year, to do that, you're going to need about 185 MedSup apps. 185 MedSup apps at an average premium of $1,500 would get you that 275,000 in MSL credits needed. If you did all of them via an e-app, that's over $2,700 in marketing credits. If you want to continue to do paper apps, however, you're going to earn half of that at $1,387 in marketing credits. Now let's go to our new Q2 MedSup Broker Bonus program. This program looks much like programs we've been running in quarters past, but this one is starting again for April 1st through June 30th of this year. And just like the marketing credits program, in order to qualify, the first thing that you need to do as an agent is issue at least 5 MedSup apps in a given month. Those apps can be from any state, they can be for any plan that we offer in that state, and they can be any underwriting type. However, the bonus will only pay in given states and on certain plans. John has a copy of the flyer, and he will be sending that out with this presentation. But I do want to note the bonus is paying $150 cash per app for each fully underwritten app and $30 per open enrollment app. And the payments are always going to be based on the policy effective date. So much like the marketing credits, how much can you earn? This program also has no limit on the amount of dollars that can be earned through the bonus program. So same assumption, let's say you want to come with us to London next year. That equates out to about 16 MedSup issued apps per month. If half of those apps you do each month were fully underwritten, that's 8 times 150 or $1,200. And if the other half are open enrollment, 8 times 30 is $240, so over $1,440 for those 16 apps with the broker bonus program. All right, let's talk now is talk specifically about the Texas market with respect to Medicare Supplement. Within the Texas market space, there's over almost 4.1 total Medicare beneficiaries within the given state. Over 2.6 million of them are on original Medicare, and over 1.4 million are on a Medicare Advantage plan. Let's jump in and look at rates. I want to point out that always being the lowest price carrier might not always be the best option for your consumer. In many market spaces, Texas, no question to that. Mutual of Omaha will most likely not always show as the #1 ranked carrier when you're doing a rate quote, but I want you to consider other things other than just the lowest price. Think back of things that I talked back earlier, such as our longevity in the market, our rate stability, our household discount, our brand name recognition, our AM Best rating, the fact that we do not charge a policy fee. Those are all things that should be taken into consideration when you're looking at rates. But for this example, I went ahead and pulled zip code 75401 in the state of Texas. It's going to be for a female age 67, non-tobacco with that 12% household discount applied, or the respective household discount for the other carriers listed. Now, I don't have carrier name here, but I wanted to show you how we stack up selling within this zip code. So here are the rates as of April 1st. So you can see in this scenario, there's carrier 1, 2, 3, and 4. We sell as United World in the state of Texas right now, which is an affiliate to Mutual of Omaha. But you can see we're currently ranked actually number 15. But look at the carriers ahead of us. We definitely have a very strong AM Best rating at that A+ ranking. We've been selling under the name of United World now for over 15 years, which definitely shows to our experience in the market space compared to others on this list. But look and see how competitive this market space actually is. The difference between carrier #1, meaning the lowest price carrier, and us, United World, is less than $10 per month. We don't charge a policy fee, so the annual cost between the lowest price carrier and to Mutual of Omaha is only $88 on an annualized basis. So make sure when you're doing your quotes that you're really looking down at the entire list to see who is going to be that best option. In a tight market like this, where the differential on a monthly basis and annual basis is less than $100, I hear from agents all the time they can sell the Mutual of Omaha brand name based on our reputation and experience, usually up to $10 or $11 more per month. Consumers are willing to pay for that brand name recognition and the experience that we offer to them. Right, let's jump now to our prescription drugs plans that we now have available. This is a new product offering that we began selling this past AEP. And you might be asking, why is this your first time entering into this market space? You've been selling senior solutions for quite some time. This was the time for us to enter the market for a multitude of reasons. One, I mentioned earlier, we have a very large in-force block of Medicare Supplement policyholders, over 1.4 million, and that number continues to grow. Of those, 85% of Medicare Supplement customers also plan to purchase a PDP plan. And of those, 73% of them intend to buy their MedSup and PDP from the same carrier. So you can see by not having a product offering, we're missing out on market potential to best serve those 1.4 million customers that we currently have from a MedSup in-force block. So starting last AEP, as I mentioned, new for 2019, we began offering PDP plans under the name doing business as Mutual of Omaha RX. That is how you will find us on Plan Finder, and that's how we market our name. It is underwritten by Omaha Health Insurance Company, or OHIT, which is an affiliate to Mutual of Omaha. And we have 2 prescription drug plans available across the entire country except for the state of New York. That is going to be the only market in which we are not selling in. The 2 plans that we offer, this is going to be the first one. It's going to be referred to as the value plan. The value plan is going to come with a low monthly premium, and it's going to be a good option for consumers who do have a pretty low drug utilization. The annual deductible on tier 1 and tier 2 is 0. For tiers 3 through 5, it's $415. And then you can see on that tier 1 preferred generics, the preferred retail is $1 for that copayment. On the RX Plus plan, this one is going to be a good option with a reasonable monthly premium for people that might need broader drug coverage. This one, the deductible is $415 for all tiers. And you can see on that tier 1, the preferred generics, the preferred retail for 30 days, it's a $3 copayment. Regarding the formulary, both of these plans come with a very strong formulary. The value plan, 49 of the top 50 drugs that are commonly prescribed are within tier 1 and tier 2. And the value plan has over 2,800 total prescriptions within that formulary. On the Plus plan, 48 out of 50 of the most commonly are in tier 1 or tier 2, with almost 3,200 total drugs within the formulary. In that state of Texas, that's going to be region 22 for prescription drug plans. The Mutual of Omaha RX value plan is coming in at $29.20, and the Mutual of Omaha RX Plus plan is $44.80 per month. Regarding that pharmacy network, we do have over 24,000 preferred pharmacies, with those being led by CVS, Walmart, and then local grocery store chains such as Wegmans, Meijer, Giant Eagle. We do have 43,000 standard pharmacies, which would also include things like Walgreens and Costco and many independent and local pharmacies, bringing that total pharmacy network to over 67,000 in-network pharmacies. All right, so if you're interested in selling this new prescription drug plan, there are a few things that you will need to do as a writing agent. Step number 1 is, because this is a new product offering underwritten by a new company name, we will need for you to actually submit contracting. So you will need to reach out to Premier Senior Marketing to get that producer contract. Once you get that done and complete and turn back into them, you will need to submit a copy of your 2019 AHIP certification to Mutual of Omaha. And then last but not least, you will need to take and pass our prescription drug training that is available on our agent portal. Right, let's jump into some of the ancillary products available within the senior market space. And the one I want to share with you today is going to be our individual dental product. The individual need for dental is definitely there. Specifically with respect to the Medicare market, we know Medicare doesn't cover for most dental services. It's one of the most popular ancillary product fillings that you can make. When you think about it, a lot of the people that you're helping, if they're coming off of employer coverage, they have most likely probably had dental coverage throughout their working years. So why would their retired years be any different? So this is a great offering for you to make and to make some additional monies. What do people say out in the market space? Well, 76% of seniors do say they plan to visit the dentist within the next year. However, almost 2/3 of those Medicare beneficiaries, or nearly 37 million people, do not have dental coverage. So big, big, big market opportunity for you just within the senior space. And I point that out because our product offering, while designed for those individuals that are on Medicare, we actually have product offering for ages 19 to 99. So it's definitely a broad market product for you. The product itself is guaranteed issue. It's unisex community rated. You can sell it with our Medicare Supplement product, or you can actually sell it standalone. So if you come across a client that is in need of individual dental coverage, they can definitely purchase that with or without purchasing a Medicare Supplement with us. With respect to our provider network, we have partnered with Dental Max Plus, which includes dentists from Dentamax, United Concordia, and Connection Dental. Combined, they have over 375,000 dental provider locations across the entire country. Right now, as of February 1st, this is what our product approval map looks like for that individual dental product. You can see the blue states are the states in which we have a product approval. There are only 4 in which we're still are waiting for a DOI to approve our plans. Those would include the states of Washington, New Mexico, Virginia, and New York. But in the great state of Texas, we have over 55,500 in-network dental provider locations for your consumers to access with either one of the plan offerings that we have. The 2 plans that we have are referred to as the Preferred and the Protection Plan. I mentioned earlier the issue ages of 19 to 99. On the Preferred Plan, the calendar year deductible is $0 for the preventive and then $50 for basic and major. Preventive, which does provide up to 2 cleanings per year, would pay at 100%. For basic, which includes fillings and extractions, the plan pays 80%. For major services, after a 12-month waiting period, the plan is going to pay 50%. And the calendar year maximum, or the calendar year benefit on the Preferred Plan is $1,500. One thing I want to point out to you is I hear a lot of good positive feedback is that both of these plans offer a lifetime benefit for implants. And on that Preferred Plan, the lifetime max benefit is $3,000 for an implant. Shifting over to the Protection Plan, same thing, issue ages 19 to 99. The calendar year deductible for that plan is going to be $100 for all services combined. Same as the Preferred, preventive services, it pays 100%. On basic, the plan would pay 50%. And then just like the Preferred Plan for the major services after a 12-month waiting period, the plan pays 50%. The calendar year benefit on the Protection Plan is $1,000, and the lifetime max is going to be $2,000. Both of these plans do come with an optional vision rider. That optional vision rider is $8.28 per month. Benefits that provides, it's up to $50 every calendar year for an eye exam. That does not have a waiting period. And then every 2 years, the plan with the rider provides a $150 benefit for eyeglasses or contact lenses after a 6-month waiting period. In that same zip code that I did the MedSup example in of 75401 in Texas, the Protection Plan is $24.96 per month. The Preferred Plan, $43.66 per month. And as mentioned, that optional vision rider is $8.28 per month. To see if a dentist that you would like to see is in network, you can visit dentistforme.com/Mutual of Omaha. Or to potentially request for a dentist to be added to the network, you can actually call 800-872-3860. How do you enroll? Well, the way I would definitely recommend enrolling is to go ahead and use our e-application tool that we have available for dental. We have a standalone dental e-app, or every time you do a Medicare Supplement e-application, the dental product, if it's approved in your state, is actually presenting itself at the very end of the MedSup sale. If you do that cross-sell right then and there, and you indicate which dental plan that consumer would like to enroll in, it will carry over all the information that you had already input from the MedSup app, making this application to complete, taking about 1 minute of your time to make that ancillary sale. So I definitely cannot promote the e-application enough. It's definitely going to be a great tool that you want to be using. All right, let's jump now and change gears. This is the fourth item I wanted to talk to you today, which is going to be our Medicare Advantage offering in the San Antonio market. Much like the prescription drug plans, this was a new offering for Mutual of Omaha in AEP for 2019. Please note we are selling under the name of Mutual of Omaha Medicare Advantage. That will be how you see us marketed out in the San Antonio market space. The number of Medicare Advantage enrollees within Bexar County, which is where San Antonio is over 132,000. The Medicare Advantage penetration within that county is 45.5%. In year-over-year MA enrollment growth is sitting at 7.8%. So large opportunity for all of you within that given area. The plan that we have available within Bexar County is going to be the Care Advantage Complete. It is a $0 monthly premium plan. So switch here regarding the network. The network that we have partnered with is the Baptist Integrated Physicians Partners network within Bexar County. As I mentioned, the market space is going to be San Antonio with the service area of Bexar County. It's a $0 monthly premium plan. And I'm not going to read through all the extra benefits on this plan. This presentation will be shared with all of you after this recording today. Some of the RX highlights, though, included with this Medicare Advantage plan include our preferred pharmacies would be Walgreens, Walmart, and Sam's Club, just to name a few. It's a $0 copay on Tier 1 and Tier 2 for mail order with a 90-day supply. No deductible and low copays on Tier 1 and Tier 2 drugs at preferred pharmacies. And then we have that 30, 60, or 90-day supplies for mail order options. From a customer experience, this plan does come with a fitness program through Silver Sneakers at no additional cost. It also has an over-the-counter benefit for basic health and wellness products that might be purchased. And it also has a transportation benefit available for one-way trips to medical office visits. Just like the PDP product that I talked about earlier, because this is a new product offering, if this is something that you are interested in selling within that market space, you will need to sign a Mutual of Omaha Medicare Advantage contract. To get that, you need to reach out to Premier. They can get it to you. They can get it submitted to us. Once that is complete, just like PDP, we would need a copy of your 2019 AHIP certification. And you would also need to take and pass the Mutual of Omaha Medicare Advantage product training available on our agent portal. And then I wanted to close out with just a quick update on a new monthly webinar series that we started here in 2019. Each month we have a new topic that we're discussing. It's usually held on the 4th Tuesday of each month. They will always be at 10:30 Central Time. And on average, they've been each lasting about 8 to 12 minutes. So they're very short in time, and we want to keep them timely, to the point, and giving you the relevant information that you need at that given time. How do you join? Well, each month, if you already have a contract with us, you will get an email invitation to join the upcoming webinar. On the day of the webinar, you just quickly go into that email link again to join in, and you can listen either from your computer, your telephone. It's really going to be easy for you to join in and to hear what we're talking about. During the webinars themselves, we do take questions. We don't answer the questions during the actual event. What we've been doing is allowing the questions to come in, and then the next week in our agent communication known as Express, we actually have a frequently asked questions section from the previous webinar, and we go over all the answers at that time. I do want to point out, last week we had a webinar on MACRA. We had over 400 people attend that webinar, which is huge attendance, and we had a lot of great questions come through from agents like yourselves. And tomorrow in Express, we will actually have all those questions with answers listed on the Express. So I would definitely look for that article tomorrow in that communication. What are some of the upcoming topics that we have? Well, this month, we're going to go a little bit more in depth on that dental product that I talked about earlier. That event will be held on April 30th. On May 28th, you'll have the ability to hear from our underwriting MedSup director. You can hear from him how it is that we are able to do things so quickly and efficiently that we do from a MedSup perspective. And then the end of June, we'll be communicating some hot new products that we have available with new rates coming to specific markets across the country. And you'll probably hear some new news on maybe some upcoming marketing programs that we have available for Q3. So be sure to tune in to any one of those 3 events that are upcoming. With that, today, if you do have additional questions, I encourage you to call John and his team. Their number is going to be 800-365-8208. So with that, I'm going to turn it back over to John. John?
Thank you, Christy. Pulling the screen back now. We appreciate that. The only question that we have is your macro presentation, was it recorded?
The macro presentation was recorded, and if that agent does get a copy of our Express communication, they can rewatch it through Express tomorrow.
Awesome.
If not, John, I will send you the link and you can send it out with this presentation.
Okay, that'd be awesome. Thank you very much. So what you have heard today is a lot of information about great options for you here in the state of Texas. You realize, of course, that the prescription drug program is available in every county in the state, and you've got a solid option available for a Medicare Advantage plan in San Antonio and Bexar County. And then, of course, the Mutual of Omaha Medicare Supplement programs that go well beyond premium with all of the strengths that carry on through the premium stability and the marketing support. This is an awesome opportunity for folks in the state of Texas. And one of the reasons you'd want to do that with us, and thank you again, Christy, for the presentation, is Premier is going to offer some additional assistance for you in order to help make this a success. Contracting is simple for multiple carriers by creating an agent profile, Insurance Bay, and contracting electronically. It's a great way to make certain that you cover all of the opportunities that are available to you through the carriers available to you as well. And as an independent insurance agent, we want to make certain that you are protected in all circumstances. Many organizations will offer complimentary E&O on their blanket policy for programs that you contract with through them. However, I know of very few agents that put all their contracts with a singular organization, and this program with discounted errors and emissions coverage make you a true independent agent with protection across the board for all the programs with whom you contract. We also offer discounted continuing education programs to help you keep your license in place through our relationship with WebCE. And as an independent agent, you maintain your own benefit package as well. You have an opportunity to access non-cancelable DI coverage, disability income coverage, with modified guarantee issue, discounted rates, and you share in the commission of this program as well through our relationship with disability specialists. It's a great opportunity to add that benefit to your own package of coverage. We do a number of different training programs and offer different resources, not only with carriers such as Mutual of Omaha in today's presentation, but also with marketing concepts and opportunities to get in front of the buying public. Believe it or not, it's that time again for retail, and we have a webinar coming up in a couple of weeks on the Walmart and other retail programs as well. And we have different programs set in place that can help you market to and through faith-based organizations, marketing with providers, a number of other key activities that can keep you active and making money and serving the public year-round. And in order to support that production, we also offer access to quote engines across the board for Medicare Supplement and Medicare Advantage programs, also ancillary programs through our complimentary access to the CSG machine available to our agents that contract with us, and ways of procuring applications for Medicare Advantage programs and PDP programs on a remote basis as well. One of the things that you see as a key difference between Medicare Supplement and Medicare Advantage PDP programs is the requirement of a scope of appointment document, and we have a way for you to access that remotely as well through our Medicare Center program. And we are rolling out a new e-app program with CSG Actuarial, so watch for additional details on that in the very near future. We do also have a program that allows you to put your social media marketing efforts on autopilot through Coverage Made Easy. Details are available for that as well. And Christy noted the fantastic trip that they have available for production through Mutual of Omaha. We also offer a producers convention that next week goes to Jamaica, and 2020's trip will be announced at that time as well. There are a number of activities that you can pursue as well to stay in front of the buying public, and that includes that relationship with Ma Bell. We do have custom contact lists available for you, butted up against the do not call list that enable you to reach out and touch someone, as the commercial used to say. These programs are available at a deeply discounted rate or on a complimentary basis, depending upon your contracting situation. Those programs and trainings that we mentioned a couple of slides ago about community-based marketing programs, we have different steps for you to take that help make those very successful for you as well. If you're one of the individuals that are considering a retail marketing situation and you think that that chair in that store is going to make you successful, well, we've got some news for you, and we've got some ways, however, to make that work. So look at some of the additional opportunities we have in becoming the subject matter expert in your chosen market. We also offer, of course, the support backing up many of the programs that are offered by the carriers themselves to generate prospects. Mutual of Omaha's marketing support program, I believe, is second to none in the industry. That allows you a versatility to use the dollars that you earn the way you need to use them according to your insurance practice. It's a great way to grow your business. We also offer a pioneer program, or actually a pilot program, using internet leads that'll be rolled out here very shortly for the Medicare folks. That's already in place for folks with final expense. And we do offer direct mail support too, based on production that deeply discounts the cost of that marketing activity. It, like any type of marketing activity, depends upon consistency, and enabling a discounted rate for those programs enables you to do that month after month in order to stay in front of folks. So all that said and done, what we're looking for is an opportunity to work with you to grow your business here in the state of Texas. Christy is in Omaha. Our home office is in Norfolk, Nebraska. I actually office out of the Integrity Marketing offices in Dallas. We're here. I'm not native Texan, but I got here as quick as I could, I guess, and we would like to partner with you. And for that, you have to determine, is what you heard today a solid piece to add to your overall marketing program? We truly believe that it is. And once that you come to that same conclusion, we need to make certain that you have all the information in front of you on a contracting basis to understand exactly what all is detailed in order to be effective with Mutual of Omaha, and how it can be a key component of your marketing program moving forward. You have to contract, you got to get your certifications in place for the Medicare Advantage and PDP programs, study, and make it a key component in how you market moving forward. That said, you can reach any of the marketers here at Premier at 1-800-365-8208 or through our website at premiersmi.com. We look forward to discussions with you concerning Mutual of Omaha. We thank you for the investment of your time here today, and we wish you good selling. Thanks so much, and we'll talk to you soon.